he burned his initials onto the liver with a high-powered laser. Then he sewed up the patient and acted like nothing had happened. But a week later, the new liver started to fail. The patient went back in, but this time she was treated by a different doctor, and he soon found the initials inside. The surgeon admitted it wasn't the first time he'd branded a patient, and he eventually lost his medical license. The surgeon removed a large portion of the man's skull, intending to reattach it later during an emergency brain surgery. After several weeks, his brain had healed and was ready for the piece of his skull to be reattached. But the hospital staff couldn't find it. So instead, they used a synthetic piece, which later became infected, requiring additional surgery. And the hospital still charged him $19,000 for the synthetic piece. Now the man is suing the hospital for negligence, seeking compensation for his suffering and medical expenses. If you puncture a lung, air will move in and out of the wound as you breathe. When this happens, it can fill the space in your chest, putting pressure on your heart. To stop it, find an airtight material like plastic and use it to cover the wound. Next, tape it down on 3 sides. This stops air from getting sucked in but allows it to escape. And lay down on your wounded side to keep your chest under pressure as you wait for help. A tiny tube is inserted into your artery and pushed all the way up to your brain. Once it reaches the blood clot, a small tool is released from the tip. This grabs the clot and quickly spins it. The pressure of the rotation pushes out trapped blood and water, shrinking the clot. And once it's small enough, the tube sucks it up, leaving your artery clear for blood to flow. Inside, the stomach is cut and stapled, and a small pouch is created. This new pouch is only about the size of an egg. Then, the small pouch is connected directly to your small intestine and becomes your new, drastically smaller stomach. This new stomach can only hold about 1 ounce of food, which helps you cut down on eating and drop weight. If you're really short, a doctor can make a small incision into your thigh and carefully break your femur in half. Then the ends of the broken bone are gradually and slowly separated, at which point a rod is inserted to hold the bones in position. This stimulates the body to grow new bone in the gap, inching you up over time. Soft tissues like muscles and nerves also grow to accommodate the increased length. Once everything has hardened and strengthened, you'll be a taller version of your old self. When an EpiPen is injected into your thigh, a spring-loaded mechanism triggers the release of a needle. This needle then quickly delivers a pre-measured dose of adrenaline into your muscle. The adrenaline acts rapidly by constricting your blood vessels, which decreases swelling and relaxes the muscles in your airways. During an allergic reaction, this makes it easier to breathe and prevents you from suffocating. A doctor can make an incision on your neck if you can't breathe, carefully cutting all the way through the skin and fat underneath. They'll move and reposition the thin muscles and connective tissue that surround your windpipe. And finally, they make an incision in your trachea and insert a breathing tube. This causes the air to bypass your blocked throat, allowing you to breathe. If type A blood is injected into a type B patient, you'll immediately start to have chest pains and feel feverish. And this is because your immune system is attacking the foreign blood, which causes the blood cells to break down. And within just a few minutes, your blood pressure could drop dangerously low, and your organs might begin to be damaged. This could eventually lead to a heart attack if you're not treated. When you hiccup, the muscle below your lungs suddenly contracts. This involuntary spasm forces a downward motion, which makes your lungs pull in a quick breath. As the air is traveling down your throat, it's abruptly stopped by your vocal cords snapping shut. And this sudden stopping of the air movement is what makes the hic sound. A woman suddenly lost consciousness while a fake doctor was performing an illegal laser treatment on her. And instead of taking her to the hospital, he shoved her body into a suitcase. He left this suitcase in his garage for weeks while her family and police searched for her. To hide the evidence, he buried her body in the garage and poured concrete over it. The remains were discovered nearly a year later, and the man was sent to prison. He felt everything as the scalpel sliced into his abdomen, but he couldn't move or cry out. That's because he was given drugs to paralyze him, but they forgot to give him the drugs to knock him out. For 16 minutes, he was wide awake in extreme pain until the doctors finally put him under. After the surgery, he couldn't sleep and became paranoid from the trauma. And tragically, he took his own life just 2 weeks later. The surgeon cut off the handle of a screwdriver and implanted it into the man's spine after realizing that he was missing the correct tools. Days later, the screwdriver snapped in the man's spine, causing severe pain. He was rushed into surgery to repair the damage, but the man's health kept getting worse. After 3 more spine surgeries, the man passed away only 2 years after the screwdriver was implanted. His family sued and won, and the surgeon lost his license. They slice a thin layer of skin from a dead person's body. Then it's sent to a lab where every living cell is scrubbed away. This leaves behind a clean, flexible sheet made of collagen. It gets freeze-dried, sealed, and sent to your doctor. There, it's soaked in water and slid under your gum where it's shaped and stitched in place. Over time, your body fills it with living cells, turning dead tissue into your own gum. As she sneezed, it ruptured a disc in her spine, and when it collapsed, a nerve got trapped between her 2 vertebrae. Suddenly, she couldn't move. And even though she had 3 separate operations, she still suffered extreme pain. For the next 2 years, she was bedridden, needing painkillers so strong she would hallucinate. But finally, doctors inserted a plastic cage around her spine, relieving pressure on the pinched nerve. And within a week, she was walking again and holding in her sneezes. A small balloon is placed under the scalp near the hairline, and over the next few weeks, doctors slowly fill it with liquid, causing the skin above to stretch and grow. This creates a visible bulge as the skin expands. Now, once there's enough extra skin, a second surgery removes the balloon, leaving a flap of stretched skin. The hair-covered scalp is then pulled down and carefully stitched in place, and over time, you'll have a shorter forehead with more hair. She danced along to music while operating on her unconscious patients, and she would post the videos online, even singing as she cut into someone's face. But when a woman went in for liposuction, she had a heart attack on the operating table. And when she woke up, she had severe brain damage and had to use a wheelchair. After seeing the doctor's videos, the family was shocked. They sued her for being distracted during surgery, and she lost her medical license, putting an end to her career and her channel. He accidentally swallowed the plastic fork while goofing around. Now, he assumed it would just pass naturally, and he moved on with his life. But 10 years later, severe stomach pain and vomiting blood sent him to the hospital. Doctors were shocked to find the 9-inch fork lodged in his stomach. The prongs had pressed into the lining, causing a bleeding ulcer. A 45-minute surgery was needed to remove the fork safely. They pulled pieces of the tumor through her skull and straight out of her eye socket. You see, she had a tumor wrapped around the top of her spine, but it was too risky to operate in that area. So instead, surgeons cut her lower eyelid and removed part of the bone. Then they took out a section of cheekbone, making a tunnel to the upper spine. Surgical tools and a camera were inserted. Then, piece by piece, they carefully cut away the tumor and pulled it out of her eye. They connected an artery from the sheep directly to a vein in the human patient. The animal's blood would then flow into the human's bloodstream, which they thought would help. But as the blood was replaced, the immune system recognized the sheep blood as a threat and attacked it. This triggered severe reactions like fevers and intense pain. Blood clots could form, leading to blockages in vital organs. And some patients experienced kidney failure, went into shock, and died. A doctor injected what he thought was medicine into the man's spine, but it turned out to actually be a toxic chemical meant to preserve the patient's eye after surgery. Both bottles were unmarked and switched by another person in the operating room, and the doctor injected the wrong chemical into the patient. Within seconds, the toxic chemical traveled through the spinal fluid, causing irreversible brain damage. The man was considered brain dead and went into a coma, dying just 5 days later. If you removed your eyeballs and then your skin, you would definitely still be the same person, just without eyeballs and skin. And if you continued removing parts of your body, like your muscles, nerves, and blood vessels, you'd still technically be you, just as a skeleton. But what if you took all of these parts and assembled them onto a new skeleton? Would you still be you? Or would the new skeleton with all of your parts be the new you? Who is who? After delivering the baby, he carved his initials in her skin with a scalpel. And even though the nurses saw, they didn't tell the patient. When she got home, she felt excruciating pain. And when she looked in the mirror, she was horrified at what she saw. The cuts left permanent scars, meaning she needed extensive plastic surgery. She sued the doctor for almost $2 million. And even though he lost his medical license, he never went to prison for his crime.